Hi, my name is Joy Hatfield. I'm the Nursing Director of Cardiology Services here at St. Joseph Hospital. I'm talking to you today about a few helpful hints about taking your blood pressure at home. So first things first, we here at St. Joseph Cardiology don't recommend any particular brand of home blood pressure monitor, but the most important thing is that the blood pressure monitor you use at home works for you. There are several different kinds. American Heart Association absolutely recommends that you have a home blood pressure cuff that fits around your upper arm. There are other types of blood pressure cuffs out there that you can buy. There are ones that fit on your wrist and ones also that fit on your finger. We strongly recommend that you use the cuff for your upper arm. The wrist units are not quite as accurate and they don't have a warranty anywhere near as long. And the ones that fit on your finger to take your blood pressure are very unreliable, and we really recommend that you don't use that type at home. I'm going to show you briefly how to use the one that goes on the wrist, just in case that is what you have. We have one here that fits around your wrist. The nice thing about the newer ones that are out there now, they have Velcro and they're really easy to use. It simply fits on your wrist facing you, and you secure the Velcro. Whenever you put a blood pressure cuff on, you should be able to fit one finger under the cuff so it's not too snug to start out with. The most important thing in getting an accurate blood pressure reading is that the blood pressure cuff itself is at about the level of your heart. So you can see it's a little bit harder to do when it's on your wrist. You want to make sure it's not setting down on a surface because that's nowhere near where your heart is. Hold it up. Best idea is put your elbow on a table so that your wrist doesn't move, and simply press the on button and it will take your blood pressure. I will show you how it actually is done on the arm unit, but there are wrist units out there that you may want to use. When you go to the pharmacy to pick out your blood pressure cuff, turn the box around. It's very important to look on the back of the box for what the specific blood pressure cuff is capable of doing. A lot of them are different. And for some of you that may have irregular heartbeats, we call it atrial fibrillation as well, it's very important that you look at the back of this box because it will tell you whether the cuff that you're selecting works for atrial fibrillation, and a lot of them do not. You also really want to look down at the cuff size. It will measure in inches around your arm. You want to get the right size. If your blood pressure cuff is too small or too large, it will not give you an accurate reading. Have the pharmacist help you. Go up to the pharmacy counter, tell them you want a home blood pressure cuff, and have them help you pick out the right one. So for the upper arm blood pressure cuff machine, it comes with a digital machine. They're easy to use. It comes with a cuff that plugs into the side of the machine. Very easy to put in. A lot of these have a fancy little stopper that's inside of them so that the cuff won't come completely apart, so you can slide it up your arm without having to fumble with the Velcro. But if it isn't, just fold the Velcro over a little bit so the cuff is intact and you can slide it up your arm. You want to make sure that you don't have any clothing between you and the blood pressure cuff. On all of these upper arm ones, you're going to find some kind of an indication that says ART, that means artery, and that's where your pulse is. And about the inside middle of the crease in your elbow is where your pulse is. So you want to center it there so you get the most accurate reading. And then just pull the Velcro so that it's snug. You can still fit one finger underneath. And this one also shows you which way is down towards your hand so you don't get it on upside down. So again, your blood pressure cuff should be centered with your heart. And you want to hold your arm still, whether you rest it on a table or against your leg, as long as your arm doesn't move. And just simply press the on button. Our blood pressure is made up of a top number and a bottom number. The top number is called our systolic blood pressure, and that's the pressure in our artery when our heart squeezes. The bottom numbers are diastolic, and that's the pressure in your artery when your heart is relaxing between heartbeats. A normal blood pressure, we call it 120/80. Anything higher than 140/90 is called hypertension, and that's high blood pressure. It's very important to take your blood pressure at home. The big problem with hypertension or high blood pressure is that it's a quiet disease. It doesn't have any symptoms. We don't have pain. We don't have discomfort, but over a period of weeks, months, and years, high blood pressure can damage the organs in our body, and that's very, very hard to reverse or do anything about in the long run. It takes up to half a minute to get your blood pressure reading. And you'll feel the blood pressure cuff squeeze. When it starts squeezing, very important to not move. So you can see I'm 151/96, so I'm a little bit anxious about being on video. You'll have your diastolic, your systolic and your diastolic, so 151/96, and most of them will tell you what your heartbeat is too. That's your pulse. 108, still a little bit of stage fright. So glad to have the opportunity to talk to you today. There are a few other helpful hints about your blood pressure at home. You should take it a few times a day. And each time you sit down to take your blood pressure, take it 2 or 3 times so you know you don't have a false reading. And then most of them have warranties, 1, 2, or 5 years, and they'll show on your machine. But how do you know your blood pressure cuff is accurate at home? Best hint I have for you is take it to your doctor's office every year. When you go for your annual physical, when they take your blood pressure with your home machine and make sure it's really close. Anytime that those numbers don't match or you think your blood pressure machine isn't working right, they all have 1-800 numbers on the box, and they can call and help you through troubleshooting just to make sure that you're doing everything right. So again, it was wonderful talking to you all today, and St. Joseph Hospital Cardiology is very proud to be in the Bangor area. Thank you.